Namaste to all. I, Dr. Aarya Sharma, congratulate Dr. Arjun Dave and Vedant Knowledge System for organizing such a gala event to celebrate Viksit Bharat at 2047. It's an honor to chair this session and go through all the paper presented by the students.
Good afternoon, everyone. Thank you for joining this evening. I'm presenting a critical review of an emerging imaging agent, which is F18 fluoride PCT for the therapeutic localization of hyperfunctioning parathyroid glands. This is relatively new application of recently advanced FDA-approved cardiac tracer, and the preliminary evidence is very promising. We'll explore what makes this tracer unique compared it to established methods and discuss where it might fit into the clinical practice. By the end, we will understand both the exciting potential and the current research gaps. Now let's begin with thing is let's start with the clinical context is primary hyperthyroidism or PSPT is the third most common endocrine disorder globally behind thyroid disease, and the disease is characterized by autonomous unregulated secretion of parathyroid hormone from one or more glands, leading to hypercalcemia, elevated serum calciumia. Here, critical point, even the patient who appear asymptomatic, those without classic symptoms like bone disease or kidney stones face significant long-term morbidity. There are elevated risks for nephrolithiasis or nephrocalcinosis, progressive cortical bone loss leading fragility, fracture, subtle neurocognitive deficiency, and important cardiovascular dysfunction, including hypertension and left ventricle hypertrophy. The curative standards of care is surgical removal of the abnormal glands, parathyroidectomy, and for this to be successful, we need to know exactly which glands or which gland are abnormal before the surgeon opens the neck. That's where perioperative imaging comes in, and that's the focus of our discussion today. The epidemiology or surgical strategy. Let me break down the epidemiology. About 80 to 85% PSPT or single benign adenoma cases arise from this. Okay, then this is the important because if we identify that one gland is preoperatively, the surgeon can perform what's called a minimal invasive parathyroidectomy or MIP, focused targeted approach. About 10 to 15% of cases involve multi-glandular disease, meaning two or more glands are abnormal. Less than 1% of parathyroid carcinomas, but they are clinically significant outliers. Now, why does therapeutic localization matter if imaging correctly identifies the abnormal gland? The surgeon can do a minimal invasive approach, shorter operating time, and smaller incisions, fewer complications, faster recovery, and better cosmetic results. Patient can go home the same day or with minimal hospitalization. In contrast, if imaging fails to find the adenoma, the surgeon may have to resort to bilateral neck exploration or visualizing all four parathyroid glands. This is more expensive, takes longer periods, higher risk of post-operative hypocalcemia and recurrent laryngeal nerve injury, and sometimes leads to surgical failure with disease persistence or recurrence. So the stakes are high. Accurate predictive imaging directly impacts patient outcomes. Uh, but they have significant limitations. Ultrasound is operator dependent. We all know this. You can have sensitivity ranging from 51% up to the 96% depending on the sonographer skills and experience. That's a huge range. Okay. And technician 99 may be spec performs reasonably well in straightforward cases, but often fails in challenging scenarios. small adenomas, patient with multiple abnormal glands, or those with nodular goiter in these difficult situations, sensitivity can drop to about like 50%, barely better than a coin flip, right? Uh, so, because of these limitations, there's been a strong decades long push to explore more advanced imaging options, and that's where PET imaging enters the picture. Uh, by that, it means is like to understand how modern radio.
First paper was presented by Adnan Majid on the topic A Critical Review of the Clinical Promises of F18 PET-CT for Preoperative Localization of Hyperfunctioning Parathyroid Gland. The session presented a comprehensive and a critical appraisal of the emerging role of F18 PET-CT in the preoperative localization of hyperfunctioning of parathyroid gland. The topic is highly relevant to the contemporary endocrine imaging, particularly in the context of increasing adoption of minimally invasive parathyroid surgery and limitations of conventional imaging modalities. The speaker provided a clear overview of the challenges associated with standard localization techniques such as ultrasonography and technetium scan, especially in cases of multi-gland diseases, ectopic glands, retrooperative neck surgeries, and discordant image findings. Against this background, the session effectively positioned F18 labeled PET trackers as a promising alternative with superior and spatial resolution and quantitative capabilities. A major strength of this session was critical evaluation of different F18 PET trackers, particularly highlighting their biological rationale, imaging protocols, and diagnostic performance. Presentations discussed evidence demonstrating highly sensitive and specificity of F18 PET-CT in localizing hyperfunctioning parathyroid tissue, even in challenging clinical scenarios. The role of PET-CT in reducing operative time, improving surgical confidences. Importantly, the session did not overlook the limitations and particles consideration issue related to the availability, cost, and radiation exposure. The speaker also emphasizes the importance of appropriate patient selection to maximize clinical benefits and cost effectiveness rather than advocating indiscrimination use of advanced imaging. As a session chair, it was encouraging to observe a balanced and evidence based study beyond the enthusiasm to the realistic clinical appraisal. The session highlighted the growing body of data supporting F18 PET-CT as a valuable problem-solving tool, particularly in patients with negative or inconclusive conventional imaging. In conclusion, the session underscored the significant clinical promises of F18 PET-CT for preoperative localization of hyperfunctioning parathyroid gland with appropriately emphasizing the need of future standardization, multi validations, and health economic analysis. Thank you.
Hello everyone, myself Ashwati Rajesh. I am pursuing nuclear medicine technology at Jain University. Today I am going to discuss about Indic origin radiotheranostics phytotechnology. So this is a new concept using Indian medical plants to create radiopharmaceutical. So it aimed to make a cancer diagnosis and treat more affordable and accessible. So these synthetic traces are expensive and difficult to manufacture. Indian medical plants offer rich, low-cost source for developing new radiopharmaceuticals. Why botanical radiotheranostics? Current agents are costly and complex to produce and widely available. So these challenges highlight the need for the more sustainable and accessible alternative. When we come to the limitation, many Indian plant components naturally bind tumor receptor with high selectivity. They can also enhance the effect of the radiation, improving cancer therapy. Photochemicals like curcumin, piperine, and nabilod and have a strong anti-cancer properties. These components form the basis for the potential radiotherapeutic agents. Key Indian photochemicals, which will be natural variability, stability issues, and poor bioavailability, limit development. And also, the regulatory approval for the botanical radiopharmaceutical is also a complex. So, when we come to the cancer pathway modulation, Indian phytochemical can block major cancer pathways, which will be help for the reduced tumor growth and cancer cell survival. Structure and compatibility for the radio labeling. Phytochemical contain functional groups that easily bind chelators during radio labeling. This makes them suitable for developing stable radiopharmaceutical. Chelators and radionuclides. Chelators like DOTA, NOTA help attach radionuclides such as technetium 99M, gallium 60S, or lutetium 177. Choosing the right chelator isotope combination improve the imaging and therapy performance. Then, when we come to the advantages, many Indian phytochemicals act as natural antioxidants. This protect radiopharmaceuticals from degradation and increase their stability. The methodology goes like start with the computing, like computer screening to identify useful photochemicals. Then proceed through the radiochemistry, lab testing, and animal imaging studies. So, the promising Indian botanicals will be curcumin with apparent a nebuloid, which will be show the strong tumor targeting potential. They are leading candidates for the IRP-based radiopharmaceuticals. Key challenges will be variability, stability issues, and poor bioavailability, limit development, and also the regulatory approval for the botanical radiopharmaceutical is a little complex. Then, when we come to the future directions, AI, nanotechnology, and alpha emitters can greatly advance IRP research. So, this will be the future directions and precision oncology, where it is supporting the personalized cancer care using cost-effective and natural ligands. These agents improve tumor targeting and enable individualized therapeutics. So, I would like to conclude this. Indian botanical can transform nuclear medicine through affectable natural theranostics, and this approach blend modern science with the traditional plant knowledge for the equitable cancer care. So, with this, I conclude the presentation. Thank you for giving this wonderful opportunity. Thank you.
The next paper was presented by ASWATHY on the topic Indic Origin Radiotheranostic Integrating Indian Medicals Botanicals into the Next Generation Radiopharmaceutical Sciences. The session on this particular topic is timely and intellectually stimulating exploration of how India's rich legacy of medical botanical can be symmetrically integrated into the modern radiopharmaceutical sciences. The discussion successfully bridged ancient empirical knowledge with contemporary molecular imaging and targeting radionuclide therapies, highlighted a uniquely Indian contributed way for this field of precision in medicine. Speaker articulated how bioactive compounds derived from the traditional Indian medical plants, long valued for their therapeutical significant role. They can serve as a promising ligands, vectors, or modulators in radio diagnostic platforms. Particular emphasis was placed on the structural diversity of phytochemicals, their receptors, and their potential for functioning with diagnostic and therapeutic radionuclides. The session also underscores the strategic relevance of the approach for oncology and chronic disease management, where radiodiagnostic demand high target specificity. Several presentations demonstrated how plant-derived molecules could address current limitations in the synergistic ligands. Equally important was focused on traditional challenges as well. Regulatory harmonization, standardization of botanical existence was there. So, as a session chair, it was encouraging to observe a clear shift from conceptual advocacy to data driven research framework. The disclosure reflect maturity in thought and ambition, positioning Indic origin radiodiagnostic not merely as an alternative approach, but as a competitive and innovative frontliner in the next generation for radiopharmaceutical development. In conclusion, the session was established as a compelling vision for leverage Indian botanical heritage through modern nuclear sciences, fostering innovations that is culturally rooted. Thank you.
I want to say good afternoon, good morning, whatever time you are watching this video. My name is Dr. J. Samia Kamanda, a research scholar at Desh Bhagat University in Punjab, India. For this conference, I am about to present to you on the topic nutritional deficiency and immune function among women of Punjab, a cross-sectional study. I now read you the abstract. Nutritional deficiency remains a significant public health concern among women of reproductive age in India and are known to diversely affect immune function. Limited dietary diversity, social cultural practices, and inadequate macronutrient intake may contribute to the compromised immunity and increased susceptibility of infections. My objectives. The objectives of my study aim at evaluating the prevalence of key nutritional deficiency and their impact on selected immune functions markers among women aged 18 to 45 years in Punjab, India. My methodology. A cross-sectional study was conducted among 500 women. Biomarker assessments were performed to determine the prevalence of anemia, vitamin B, vitamin B12, vitamin D, and zinc deficiency. Immune function was evaluated using total leukocyte count, lymphocyte count, and serum immunoglobulin G levels. Dietary intake was also assessed through a dietary assessment record to examine the macronutrient consumption pattern among these 500 participants. The result of my study. The prevalence of anemia was 45%, vitamin D deficiency was 62%, vitamin B12 deficiency was at 36%, and the zinc deficiency was at 30%. Women with nutritional deficiency exhibited significantly lower level of total leukocyte, lymphocyte, and serum immunoglobulin G compared to non-deficiency participants at the p-value of less than 0.05%. The dietary assessment revealed inadequate intake of essential macronutrients, primarily attributed to poor dietary diversity and social-cultural dietary pattern among these women or these participants. Conclusion. The finding highlighted high burden of nutritional deficiency among women of reproductive age in Punjab, which is associated with impaired immune function. This result underscored the urgent need for targeted public health interventions, which include the intake of fortified nutritional food and also macronutrient among these participants. So I want to say thank you for listening to my presentation. Namaste, Jai.
The next speaker was Dr. J. Samuel Kamanda, and the speaker presented on the topic of nutritional deficiencies and immune function among women of Punjab, a cross-sectional study. This session addressed a critical and often under-recognized public health issue: the interplay between the nutritional deficiency and immune functioning among the women of Punjab. The presentation provided a comprehensive and evidence based assessment of micronutrition status in a population undergoing rapid nutritional and lifestyle transition while stimulating bearing a persistent burden on the hidden hunger. The study was methodologically sounding, employing a cross sectional design with robust biochemical and immunological assessment. By integrating dietary, anthropometric, Laboratory data and investigation offered a multidimensional perspective on women's health, basically the nutritional health. Finding relieved finding revealed a high prevalence of anemia, vitamin D deficiency, vitamin B12 insufficiency, underscoring the continuity of relevance of micronutrients malnourishment even in economically progressive regions such as the region of Punjab. The session also highlighted key socio-demographic determinants including rural residents and lower socioeconomic status which amplified the nutritional risk. These insights are valuable for policymakers and public health practitioners designed targeting intervention. The discussion appropriately acknowledged the limitation inherent to the cross-sectional study while clearly outlining the need of longitudinal and interventional research to establish causality. And as a session chair, it was encouraging to note the transitional relevance of the study. The study reinforced the need of integrated nutritional and women health programs that go beyond the caloric adequacy to address micronutrient sufficiency as a determinant of immune reliance. In conclusion, the session was made very meaningful, contributing to understanding of women's nutritional health in Punjab and its implications for immune function. The work provides a strong evidence base to reinform and the region specific nutrition policies and highlight the urgency for sustained public health in the domain. Thank you.
A very warm welcome to all of you. I'm very privileged to speak today in fourth international largest virtual multidisciplinary conference organized by the Vedant Knowledge Systems Private Limited, based on the theme From Gurukul to Global, Paving Path to Viksit Bharat in 2047, Restructuring Higher Education with Indic Priorities. So I'm Dr. K. Hima Bindu, working as Professor of Pharmacology at Andhra Medical College from Visakhapatnam, India. Today, I'm going to speak a little bit about how Indian dietary wisdom can help prevent and manage lifestyle disorders. So, if you look back into the lifestyle disorders in concern to the Indian diet, there are various lifestyle disorders that are mainly non-communicable diseases like type 2 diabetes mellitus, hypertension, dyslipidemia, cardiovascular disease, and metabolic syndrome, which are rising globally and rapidly in India, contributing to very huge global morbidity and mortality over the past 30 years. If we look into the risk factors, why this is happening so in the country, there is a drastic or even gradual recent shift from traditional diets to processed calorie dense foods and high intake of sugar, saturated fats, ultra processed foods with sedentary lifestyle and physical inactivity absolutely. And also in case of men, tobacco use and alcohol consumption, psychosocial stress and environmental factors along with urbanization and population aging. If you look into the India's nutritional status, earlier our forefathers, they used to have the traditional cereal pulse diets with, and now it has got shifted gradually to refined carbohydrates, added sugars, and saturated fats. So, because of which there is the population is landing upon in overweight, obesity, diabetes, and ischemic heart disease. So this is supported by ICMR India B cohort study. And there is thus urgent need for sustainable, culturally appropriate dietary strategies for non-communicable disease prevention and management. If you look into the Indian dietary wisdom, there is traditional Indian systems that is like Ayurveda, Yoga, and Siddha. They view diet or ahara as central, the core aspect of the health system in the body. So the core principles of Ayurvedic diet are fresh, seasonal, and minimally processed foods, which is individualized. That is like it varies from person to person, eating based on Prakriti and Agni as per one's own digestible capacity. And also, it must be associated with regular meal timing and home cooked meals. The yogic or sattvic diets emphasize upon predominantly plant-based, minimally processed foods which are rich in fruits, vegetables, whole grains, and dairy products, associated with metabolic balance, gut health, and reduced inflammation. So, if we look into the benefits of Indian dietary components, which our fathers and forefathers used to take, the high fiber cereals and pulses and millets and fermented foods and bioactive spices, they enhance metabolic balance, support gut health, reduce inflammation, and reduce lifestyle related disease risk. So, there is a scientific evidence for traditional Indian dietary practices in non communicable diseases prevention remains, which is fragmented right now. So, because of this, we aimed off this particular topic to synthesize evidence on Indian dietary patterns and lifestyle disorders like type 2 diabetes mellitus, obesity, CVD, and metabolic syndrome, etc., and to critically appraise existing studies and to bridge ancient Indian dietary wisdom with modern lifestyle medicine for public health nutrition. So, the core Ayurvedic principles emphasize upon the role of digestion or the Agni, the fire within the stomach, which we experience after taking the food. The Agni regulates digestion and metabolism. So, if a person is having weak digestion, so he may release the toxins which are otherwise known as ama, which contribute to metabolic imbalance and chronic disease. So, the dietary approach must be constitution-based diet selection based upon one's own kapha, pitta, and vata and digestible capacity of individual. Harmonizing food type and timing and habits of the food, it aims to improve metabolism and prevent toxin accumulation within the body. So the traditional Indian food systems consist of whole grains, millets, pulses, legumes, seasonal fruits and vegetables, fermented foods like curd and buttermilk, which we often take in the daily meal, along with uses of spice, with minimal use of refined and ultra-processed foods. And also, we need to emphasize upon importance of home cooking, where we have the so many benefits like better control of oils, salt, and additives, which encourages portion control, how much quantity we eat, and balanced meals, which supports digestive health and metabolic balance. The yogic or sattvic nutrition, which is also from the Indian origin, is predominantly vegetarian plant-based diet, which consists of whole grains, fruits, vegetables, legumes, nuts, seeds, and dairy products. And simple preparation with minimal processing of the food products emphasizes balance, moderation, and mindfulness. So, this Indian dietary wisdom integrates Ayurvedic principles, traditional regional diets, which varies from region to region, with yogic sattvic concepts, which calms the mind even along with the body as well, which offers a holistic model for metabolic health and lifestyle diseases prevention. So, if we look back into the recent uh, dietary system of the Indians, if they are most often following the Western diet, which contains high intake of ultra processed foods, refined sugars, saturated and trans fats, energy dense but nutrient poor meals, with metabolic consequences of rapid postprandial blood glucose levels and excess calorie intake but low satiety, low dietary fiber, phytonutrients, and probiotics, with impaired gut health and increased systemic inflammation. So, the health outcome could be obesity, insulin resistance, further landing upon in cardiovascular diseases, which is becoming a major contributor to global non-communicable disease burden. Whereas Indian diet emphasizes on whole grains and millets, pulses and legumes, vegetables and spices and fermented foods, with metabolic consequences like high fiber and rich source of antioxidants and bioactive compounds, which can reduce the glycemic load and better glucose and lipid control as well. So the health outcome could be home cooking and digestive spices support metabolic flexibility, reducing the overall non-communicable diseases burden globally. So, westernization of Indian food, which is happening right now in the country, with increased intake of processed and junk foods and sugar sweetened beverages quite often, and also refined carbohydrates like high processed foods and home, like ready made foods, processed ready made cans available in the market. So, it strongly is linked to rising non communicable diseases like diabetes, dyslipidemia, and ischemic heart disease with obesity preponderance. So, the public health policies can be invited to prevent all these factors, integrating traditional diets into public health policy with whole grains, millets, pulses, fermented foods, digestive and functional spices, and which can lower glycemic index, improve gut health, and reduce inflammation. They also support preventive, culturally appropriate nutrition strategies. So the policy direction should be, it should be these traditional Indian dietary principles must be integrating with national dietary guidelines and public health nutrition frameworks, and they must be included in school nutrition programs and community feeding schemes, aligning with India's shift towards prevention focused non communicable disease control, which supports healthy habits, micronutrient intake, and cultural preservation. But the key challenges are urbanization and reduced time for home cooking, increased reliance on ultra processed foods, which everyone is habituated to, and aggressive marketing of high sugar, high fat diet foods in the market, and low awareness of traditional diet benefits, which we need to focus upon. So, the way forward could be nutritional education to each and every corner of the country, both urban and rural areas, with public awareness campaigns and regulation of processed food marketing and community based school level interventions, which can lead to multi-sectorial action, which is essential to translate traditional dietary wisdom into public health impact. So, the research gaps which we have thoroughly analyzed are limited long term clinical evidence with millets, spices, and fermented foods, with stronger evidence needed to support inclusion in national guidelines, and lack of standardized Ayurvedic dietary protocols, where Ayurvedic nutrition is personalized with the prakriti of a particular individual, with the digestible capacity and seasonality of the Indian foods. And there is no uniform testable dietary frameworks for research, and it is very difficult to compare or synthesize existing studies. So, the standardization is very essential for specific scientific validation and translation. So, the future prospects could be uh, integrating Indian diets with modern science, the personalized nutrition approaches, where there is exploring links between Indian dietary patterns, gut microbiome composition, and gene diet interactions, otherwise known as nutrigenomics. So, the way forward, we can combine like multidisciplinary research combining nutrition science, Ayurveda, microbiome, and genomics. Evidence based integration of traditional diets into public health need to be followed with future research which can bridge traditional wisdom with precise precision nutrition. Thank you. Thank you very much. Thank you very much for the Vedant Knowledge Systems Private Limited for giving me the opportunity to present my original research article to present in this largest Indian and international virtual conference. Thank you. Thank you very much.
The next paper was presented by Dr. K. Hima Bindu on the topic How Indian Dietary Wisdom Can Help Prevent and Manage Lifestyle Disorders. The session offered a thoughtful and integrative perspective on the role of Indian dietary wisdom in the prevention and management of lifestyle disorders, a growing global health challenge. The development of effectively connecting traditional Indian nutritional principles with contemporary scientific understanding of metabolic health, chronic inflammation, and disease prevention. Speaker highlighted the core concepts from traditional Indian dietary practices, including emphasis on seasonal eating, dietary advice, moderation, and personalized nutrition. These principles are co existed with the modern framework of lifestyle disorders such as obesity, type 2 diabetes, cardiovascular disease, and metabolic syndromes. The session demonstrated how traditional foods choices rich in the whole plant based preparation align closely with current evidence supporting anti inflammatory oxidants and gut health promoting their diets. A key strength of the session was its balanced approach, moving beyond the cultural advocacy to scientific validation. Presentation referenced emerging evidence on the metabolic and immunomodulatory benefits of the traditional ingredients and cooking practices, while also acknowledging the need of standardization's research methodology. The session also addressed the challenges posed by the rapid urbanization, dietary westernization, and sedentary lifestyle, which have contributed to the rising burden of non communicable diseases in India. As a session chair, it was evident that the discourse successfully positioned Indian dietary wisdom as a complementary and evidence informed strategy for lifestyle disease management. In conclusion, the session reinforced the relevance of India's dietary heritage in addressing contemporary lifestyle disorders. It provided a compelling case for integrating time tested nutritional wisdom with modern scientific research to promote sustainable health outcomes at both individual and population level. Thank you.
Hello, everyone, respected chairperson and my colleagues. Myself, Dr. Mohd Basheeruddin. Today, I'll be presenting a concise overview of the advancement in cancer biomarker discovery over 15 years with emphasis on their diagnostic, prognostic, and therapeutic relevance in somatic cancer. With rapid progress a molecular biology, proteomics, and genomics technologies, cancer biomarker research has evolved from conventional proteins marker to sophisticated molecular and liquid biopsy based platform. From conventional, in this presentation, I will briefly highlight it how these advancements have transformed precision oncology, focusing on lungs, breast, and renal cancer, and discuss emerging technologies and future direction shaping personalized cancer management. Now, moving on to the outline of the presentation: introduction, methodology, results and discussion, conclusion, and references. Background: cancer biomarkers are essential for early diagnosis, prognosis, and therapy monitoring. Transition from classical protein biomarkers to molecular and genomic platform, driven by the advances in proteomics, genomics, NGS, and the liquid biopsy. Biomarkers are heterogeneous necessities, tissue specific approaches. Objective and methodologies to evaluate cancer biomarker evolution over the last 15 years in somatic cancer. Method: literature review from the last 15 years 2011 2025. Databases from the PubMed, Scopus, and Web of Science. Cancer which I have chosen: lungs, breast, liver, and renal cancer. Detection with the help of the ISC, NGS, and ctDNA. Evolution of the cancer biomarker you can see in the table. Major biomarker identified 2029 to 2024. Lungs on the basis of EGFR, ALK, CRAS. Breast HER2, ERPR, BRCA, Oncotypes DX. Liver AFP, GP73, HBV DNA, and ctDNA. Renal VEGGF. You can see in the clinical impact is the targeted and the immunotherapy. Personalized treatment with the help of these biomarkers in breast cancer. Diagnosis and the prognosis in the liver cancer and targeted therapy. We'll go one by one. Lung cancer biomarker like EGFR mutation means tyrosine kinase inhibitors. KRAS mutation G12C inhibitors, PD-L1 expression immunotherapy selection, NGS enabled mutation detection and resistance monitoring. Breast cancer biomarker like HER2 amplification, transfusion based therapy, ER/PR endocrine therapy guidance, gene expression patterns, recurrence prediction, emerging BRCA mutation, ctDNA miRNAs. Liver cancer biomarker AFP as a classical diagnostic biomarker. HBV DNA predicts disease progression and risk. CMET involved in the tumor progression and the resistance. ctDNA enables non-invasive monitoring. Last, renal cancer biomarkers VEGF drives angiogenesis and the targeted therapy. VHL mutation explain renal cancer cell pathogenesis. PDL1 guides immunotherapy. Prognostic biomarker Ki67 and ctDNA. What are the emerging technologies? Liquid biopsy, non-blood fluids like urine and saliva, immunotherapy, biomarkers, TMB, neoantigens, miRNA in the cancer prognosis. Now come to the challenges. Tumor heterogeneity, lack of standardization, and high cost and limit accessibility. We can conclude on the basis of these study, shift from protein to multiomics biomarker, liquid biopsy and the NGS, transforming precision oncology. We can do in the future like AI, artificial intelligence integration, multiomics platform, affordable diagnostic. Thank you.
The next paper was presented by Dr. Mohd Basheeruddin, Sara, Jai Ram, and Ashish on the topic of advancement in cancer biomarker discovery over the past 15 years, diagnostic and therapeutic approach in somatic cancers. The session provided a comprehensive overview of the significant advancement in cancer cardiac biomarkers discovery over the past 15 years, highlighting their life transformation impact on diagnosis, prognosis, and clinical management of somatic cancer. The presentation effectively tracked the evolution of biocardiac marker research from single gene and protein based markers to complex multi-omic and system biology driven approach. Speaker discussed the key technological milestones including high throughput genomics, transcription, and other particular biomarkers. Particular emphasis was placed on the integration of next generation sequencing and bioinformatics in uncovering somatic mutation, gene expression signatures, and epigenetic alteration that informs tumor classification and risk stratification. The session also highlighted the growing clinical relevance of liquid biopsy circulating tumors, DNA circulating tumor cells, and other things that are there for the early detection and prognosis treatment monitoring. A notable strength of the session was it focuses on the translational and clinical acceptability. Preventions illustrated how validated biomarkers now guide therapeutic discussion making. The discussion appropriately addressed challenges related to the biomarker validation, standardization, and tumor heterogeneity and clinical implication. As a session chair, it was encouraging to observe the convergence of basic science, clinical oncology, and the biology reflected throughout the session. In conclusion, the session underscores the remarkable progress made in the cancer cardiac biomarkers research over the last 15 years and highlighted future directions aimed at improving the precision oncology. The insights shared will undoubtedly contribute to more accurate diagnosis and it will be better for the patients. Thank you.
Hi all, this is Dr. Srilatha Bashetti, Associate Professor, Department of Biochemistry from Apollo Institute of Medical Sciences and Research. I'm presenting a paper for 4th International Virtual Multidisciplinary Conference, and the title of my paper is The Association of Folic Acid and Vitamin B12 in Pregnant Women with Hypothyroidism, Its Effects on Thyroid Hormones and Placental DNA Methylation. I would like to start with the saying that we have a secret in our culture. It's not that birth is painful, but it's women who are stronger. So pregnancy is a period where we have various complications, simple to that of annoying complications, which may affect physical and mental health of baby and also the mother too. And it is also noted that during pregnancy, hypothyroidism most common. This is which is seen, and the underlying reasons may be chronic autoimmune thyroiditis or else iron deficiency. And there are several studies which have stated the importance of micronutrients, vitamin B12, and folic acid during pregnancy. One interesting fact is 12% of the hypothyroid patients express one of the signs of vitamin B12 deficiency. It is noted that it also excess of folic acid has harmful effects on the nervous system, leading to cognitive impairment. And very interesting study in animals has stated that excess folic acid supplementation has caused suppressive effect of T3, T4, but not on TSH. If the same thing mimics in the humans, what will be the impact of excess folic acid on thyroid hormones? That is a question of my study. So, as objectives, we have studied the thyroid hormone levels and also vitamin B12 and folic acid in pregnant women with hypothyroidism, that is subclinical and overt, and compare that with the control group. We have studied the association of cord blood folic acid and vitamin B12 with thyroid hormones in pregnant women. And then we have taken a supplementary study wherein placenta is collected and processed for DNA methylation patterns for two genes, that is TCN2, which is related to vitamin B12, and the MTHFR gene, which is related to folic acid. This is the details of my study. These are the details of my study. Like we included 245 participants, and then before categorizing them into control, subclinical, overt hypothyroidism, we have collected the samples in the first trimester and processed the sample for free T3, free T4, TSH, folic acid, and vitamin B12. After the categorization, we have again collected the sample in second and third trimester and processed for the above mentioned parameters. And immediately after delivery, we have collected placenta and cord blood samples. Cord blood samples we have tested for folic acid and vitamin B12, whereas placenta, as said, we have done DNA methylation for two genes. So these are the normal parameters, and we used various statistical tools to get the outcome of our study, to understand the outcome of our study, like Patty's test, ANOVA, between the groups and between the within the groups, and also Spearman correlation, Pearson correlation, or a curve is also taken. It is stated that p less than 0.05 was considered to be significant. Then there are certain unexpected CPG sites on both MTHFR and TCN2 genes. Very interesting observation was we found methylation at a promoter site of TCN2 gene, stating that excess of folic acid led to methylation at the promoter site, which leads to gene silencing. So this is one of the important findings which we have seen. And also there are certain unmethylated CPG positions, unconverted cytosine, and also cytosine at the unexpected site. These were the findings, and there are several studies which have stated the importance and the complications of these micronutrients. Our conclusion of the study stated that when we have individually checked folic acid with thyroid hormones, we found no association. But when the ratio of folic acid and vitamin B12 was taken, there was association with the thyroid hormones, wherein excess of folic acid with lower deficiency of vitamin B12 has showed a suppressive effect on free T3 and T4, but not on TSH. The exception was subclinical hypothyroidism, as stated in the studies. So there are several studies which are saying that excessive folic acid has a toxicity and it leads to genomic dysregulation, and it might be leading to chromosomal breaks or else histone modifications. And it is also stated that there is a gender specific neurodevelopment toxicity, wherein female offspring were found that folic acid has altered brain gene expression, that is excess of folic acid. And it is also stated that it has affected almost many metabolism, and it is just genomic dysregulation which is one of the reasons for gestational diabetes, and then homocysteine levels in CVD, or else it might be cancer genomic dysregulation. So genomic dysregulation is leading to cancers, and very recent article has proved that most of the cancers in this present scenario are not due to DNA mutation, but it is due to genomic dysregulation, where folic acid is playing very important role. As it should be understood that folic acid and vitamin B12 are working together hand in hand, right from molecular level to that of the biochemical processes. They work together. So the outcome of the study, the take-home message of our study is less is deficient and more is toxic. It cannot be applied for folic acid. Less has a complication, excess of folic acid has the complication. So it should be maintained within the required range. And it is noted that epigenetic changes can happen anytime in the life, but if it is happening during pregnancy, there will be imprinting effect in the newborn, and that may express later in life. So one should have a check When we are administering folic acid, one should have a check on the levels of folic acid and also vitamin B12 together. Thank you. This is the outcome of my study.
The next paper was presented by Dr. Srilatha, Dr. Aparna, Dr. Vijay, Dr. Neetha, and Dr. Raghavendra on association of folic acid and vitamin B12 in pregnant women with hypothyroidism, effect on thyroid hormones and placental DNA methylation. The session addressed as an important and emerging area of maternal fetal medicine by examining the interplay between the folic acid, vitamin B12, and thyroid function in pregnant women. Women with hypothyroidism, with particular emphasis on placental DNA methylation. The topic of high clinical and biological relevance given the critical role of micronutrition and thyroid hormones in fetal development as a long-term health precaution. The presentation provided a clear rationale for investigating folic acid and vitamin B12 status in context to maternal hypothyroidism. Speakers effectively outlines how these micronutrients central to one carbon metabolism may influence thyroid hormone synthesis, regulation, and downstream epigenetic mechanism. A key strength of the session was its integrative approach, combining the clinical endocrinology, nutritional biochemistry, molecular epigenetics. Data presented suggest meaningful association between folic acid and vitamin B12 and circulating thyroid hormones, while also indicating the alternations in placental DNA methylation patterns. The session also highlighted clinical implications, particularly in the regions where hypothyroidism and micronutrition imbalance coexist among the pregnant women. Discussion emphasized the need for careful assessment of folate and vitamin B12 status alongside the thyroid monitoring rather than a single focus on the hormone replacement therapy. As a session chair, it was encouraging to observe a strong transitional thought of the discussion. The session underscores the potential of integrating nutritional interventions with endocrine management to improve the maternal and the placental health, while also contributing to the growing field of developmental epigenetics. In conclusion, the session made a valuable contribution to understanding how folic acid and vitamin B12 interact with the thyroid function in pregnancy and influence placental DNA methylation. The insight presented have important implications for antenatal care, nutritional guidelines, and future research aimed at optimizing maternal and fetal outcomes in hypothyroid pregnancies. Thank you.